اچھا اب جب نیچے تک آ جائے نا ہاں لاک کر کے پھر آگے جائے رائٹ ٹاپ کلاک وائز روٹیشن ٹاپ پہ شاباش گڈ 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 ہاں گڈ ہاں یہ بریانی کا کمال ہے شاباش بشیر ہاں اور بھی
وقار یار ایک بات بتائیں وقار
جی جی
وقار کین یو ہیئر می
ہاں ہاں آئی کین ہیئر یو لاؤڈ اینڈ کلیئر
اوکے گڈ یہ آپ نے جو بریانی کا کباب کہا ہے
کمال
کمال ہے اچھا اوکے اوکے میں پریشان میں نے کہا بریانی میں کباب کدھر سے ڈال دی
آپ سمجھے کہ آپ محروم رہ گئے
میں نے کہا میں نے تو بریانی کھائی نہیں
ایسے کرو اس کو رائٹ لاک پہ کرو رائٹ لاک کرو چھوٹے ویل کو رائٹ پہ کر دو شاباش اب چلاؤ اب اس کو آگے کرو لاک کر کے اور نکالو اس کو دیکھو اس کو یو سی دا اسکوپ اینڈ بینگ پولنگ اٹ بیک ہاں شاباش 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 وہی بریانی کا کمال ہے میرے خیال سے ہو سکتا ہے زیادہ ہو بعض وقت ہوتا ہے وہاں ٹریفک بن گیا نا
what you can do is you can deflate it and then go back in again and do it one by
بات ہاں دیکھو آ رہا ہے کہ نہیں آ رہا اس کو زیادہ اندر وہ کرو ہاں ٹھیک ہے ہاں ایسے کیونکہ اگر نہیں ہوتا نا تو اٹ مائٹ بھی کہ آپ نے اسٹون بہت زیادہ ادھر جمع ہو گئے نا ٹھیک ہے دیکھ ایک اور میں نکل رہا ہے ٹھیک ہے
that's enough inflate
انفلیٹ ہے یہ قریب ہی کریں ہاں اب پھر کرو ٹھیک ہے ہاں شاباش اچھا دوسرا داؤد دیکھیں آپ جب اس کو یہ کرتے ہیں نا تو اس پیپیلا کا ویو لوز نہ کیا کریں کیونکہ پھر آپ کو پتہ لگے گا کہ آپ کیا کر رہے ہیں ٹھیک ہے تو اس کو ہاں ایسے وہ کریں اس کو رائٹ لاک ٹھیک ہے یہ صحیح ہے اور اس کو وہاں سے
position
ہاں ہاں اب تھوڑا سا اس کو ہاں لیفٹ کر دیں یا ہاں ایسے کیا بات
very nice
ویری گڈ ٹھیک ہے یہ
insufflate some
ہاں
air as
اس
well
کو ہاں نہیں اس کو اب یہاں پہلے پوزیشن ٹھیک کریں پوزیشن اس کی ہاں
that's enough
نہیں دیکھیے تھوڑا سا اسکوپ ہاں اس کو تھوڑا سا لیفٹ ڈائل کریں چھوٹے ویل کو لیفٹ ڈائل کریں نہیں لیفٹ زیادہ پہ ہاں ایسے اور تھوڑا سا آپ باہر نکلے تاکہ آپ کو پیپیلا صحیح نظر آئے دیکھیں ہاں بالکل صحیح ہے اب صحیح ہے یہ بات سنو ایسے کیوں کرتے تم کوئی ڈبے کی بازار ہو کہ کیا کر رہے ہو کیپ اٹ اسٹریٹ یار جو ہاں ایسے ڈیفلیٹ ہے ٹھیک ہے ہاں شاباش اس کو ذرا اندر پش کرو اسکوپ اندر ایڈوانس کرو ٹھیک ہے شاباش ویری گڈ یہ دوسرا اسکوپ آ رہا ہے
very nice
ویری گڈ अब ऐसे करो कि वो अब ऊपर जाओ, ठीक है। हाँ, एडवांस बैलून ऊपर जाओ,
There are lots of stones in this DVD.
हाँ
For packed of stones.
पैक से,
Multiple stones still there.
हाँ ठीक है। हाँ इंफ्लेट बलून इंफ्लेट करें। हाँ अब आओ, देखो बहुत सारे स्टोन हैं। आओ 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 आओ, शाबाश शाबाश शाबाश, वेरी गुड वेरी गुड। अब यहाँ पे इसको पकड़ लो और उसको एडवांस करो, ठीक है, शाबाश, गुड गुड। हाँ उसको राइट लॉक करो, राइट पे टर्न करो, ठीक है। हाँ छोटे व्हील को राइट करो और आप आगे इसको ले जाओ। हाँ शाबाश शाबाश, वेरी गुड। एक मिनट, सॉरी।
थोड़ा सा ऊपर जाता हूँ।
हाँ हाँ ठीक है। आप कितने इंफ्लेट कर रही हैं?
1.2 नहीं 13 पे करें।
अच्छा ठीक है। हाँ चलो शाबाश, जरा थोड़ा सा। हाँ 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 चलो ले आओ अब, ठीक है शाबाश। अब उसको आगे करो, उसको स्कोप को आगे एडवांस करो। हाँ दाऊद स्कोप को एडवांस करो। हाँ इधर लॉक करके इसको, ठीक है, स्कोप को एडवांस करो ताकि तुम्हें नजर आए ना। राइट लॉक, शाबाश, गुड। नदीम आप बास्केट यूज करते हो क्या?
जी सर।
क्योंकि मैं भी बहुत यूज करता हूँ, मेरे अक्सर खुद ही कोई भी नहीं यूज करता।
No, I think so.
Good.
Even in the ESGE guidance, it's suggested that obviously with 3 balloon sweeps there should be 1
बास्केट
basket trawl as well.
आई यूज इट। हाँ
Because I think
ये स्टोन उधर है बेटा, इसको, हाँ स्टोन है, बिल्कुल है।
so. I think just do sequential.
हाँ अभी हाँ
Get one step, one step, one
बस, हाँ
step, one
बिल्कुल।
step, and then
हाँ क्योंकि अक्सर जो बात इरेगुलर शेप स्टोन होते हैं
जी सर।
वो या तो बास्केट का बड़ा अच्छा आते हैं।
बिल्कुल
अक्सर
ठीक।
लोग जो
I
होते हैं वो
agree.
फंस जाते हैं।
I agree,
बट
sir.
इफ यू डू इट प्रॉपरली ना, आधा खोल के उस तरफ, तो फिर देन आई ऑलवेज हैव, हमारे पास इमरजेंसी का ट्रिप होता है
जी बिल्कुल।
यूजुअली। मतलब कभी बहुत कम ही रिजॉर्ट किया है, लेकिन
So जो current baskets have this knob at the end.
हाँ हाँ
So once
वो
you
break
push it, it just breaks it
ब्रेक इट
automatically.
अप। हाँ
So I think the risk of getting stuck in the CPD is
दूसरा वो बड़ा यूजफुल होता है,
there
लोग ट्रिप
are lots
करते
of stones. So हाँ जी, because so I think what you should do is you should go right inside the duct. No, just at the lower end of the duct, inflate the balloon, come it out, then a little further up, then a little further up, then a little further up. So one by one. So go every, so yeah. So I'll probably go 2 to 3 millimeters every time. You don't actually need to do a fluoroscopy for
क्योंकि
that.
बहुत
Just keep
सारे
doing
स्टोन
it.
है, एकदम वो ब्लॉक कर देगा आपके
I think
इसको को।
that's the difficulty you're having. And I think otherwise, as Dr. Makal said, if that doesn't work, then the basket extraction would be the best thing to do afterwards. So go inside, that's enough. Inflate the balloon, not too much. You've gone
मेरा
further.
बैलून इन्फ्लेट करो।
आपने बार-बार ये करते रहना, ठीक है ना? Work together.
शाबाश, इसको आगे करो। वेरी गुड। अब थोड़ा सा ऊपर,
That's enough. That's enough. That's enough.
थोड़ा सा ऊपर जाए।
हाँ
No,
थोड़ा सा ऊपर, नहीं थोड़ा सा ऊपर जाए,
अब ठीक है।
इधर हो। इन्फ्लेट बैलून,
Very nice.
वेरी गुड. एक बात है जिससे बैलून उसमें काफी मास्टर हो जाएगा. वेरी गुड. ठीक है, चलो देखो अब थोड़ा सा. हाँ सही है बिल्कुल. हाँ इधर ठीक है बिल्कुल. हाँ इन्फ्लेट. हाँ बेटा.
नहीं, बहुत अच्छा चले गया.
अच्छा ठीक. चलो सही है. ब्रिंग इट डाउन. उसी तरह एक और स्टोन आ गया. इट्स वर्किंग. देखो कितना तरीके से कर रहे हो ना, तो एक एक करके स्टोन आ रहा है नीचे. बल्कि एक एक करके क्या, दो दो तीन तीन करके आ रहे हैं. दैट्स गुड. दैट्स वेरी गुड. अच्छा बेटा इस दफा ऐसे करें कि जब ये ऊपर बलून चले जाए ना, तो आप कॉन्ट्रास्ट इंजेक्ट करना शुरू कर दें.
ऊपर चले गया था.
शाबाश.
मिलीमीटर बाय
शाबाश.
मिलीमीटर.
वेरी गुड. बहुत आला. हाँ इस तरह करो. लाइक अ क्वारी. हाँ
जी सर.
शाबाश. शाबाश. गुड 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 गुड. इसको राइट राइट लॉक करो इसको. बैलून को नहीं, राइट 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 व्हील को. हाँ तो तुम्हारा व्यू भी आएगा और तुम उस तरह. हाँ और अब इसको आगे एडवांस करो. स्कोप को आगे पुश करो. हाँ शाबाश. और भी. हाँ, शाबाश. ठीक. वेरी गुड. हाँ काम करो क्योंकि हो सकता है आपको बिल्कुल डिप्लेट करना पड़े. हाँ आप करो. और तो उधर वो स्टोन फंसा हुआ है. हाँ हाँ शाबाश. शाबाश. गुड गुड. एडवांस करो. हाँ फुली डिप्लेट करो. खैर कोई बात नहीं. अब दोबारा.
So पता है हुआ क्या था कि लास्ट टाइम जब हुआ था ना, you actually took it all the way up. You actually have to literally take it up 1 millimeter, 1 millimeter, 1 millimeter, 1 millimeter. If you put too many out, that's exactly what the problem is.
अब check
The
करो.
issue is the stacking of the stones. Okay, so you actually have to start from the lower end, okay, and then ever so slightly keep going up. Because otherwise you're going to bring all of them together. It's going to cause edema, more difficulty, longer procedure, all sorts of problems. Okay, you know what the problem is, you know what the solution is. Okay, so you don't actually need to screen either. You can just with your endoscopic views, you can purely make that decision based on your endoscopic views. Okay, ever so slightly, every small increment with each pass.
शाबाश. शाबाश. गुड. वेरी गुड. देखो वो एक एक करके लाओगे तो आसानी होती है. वेरी गुड. अब थोड़ा सा ऊपर जाओ. रेडी. آپ ایک ہم ویری گڈ آپ ذرا اس کو ایک اپنا ڈیمانسٹریٹ کر دیں داؤد سر 1 منٹ یار ڈاکٹر ندیم کو کرنے دو ایک کہ آپ کو صحیح جیسے اب ان کو فالو کریں جیسے یہ کرتے ہیں نا کیونکہ آپ کا یہ سارا جو ویو اور سب کچھ جو ہے نا اور وہ جو ہے یو شوڈ ڈو دا رائٹ میتھڈ نا.
So I think your technique was absolutely fine, and I think the issue is, as Dr. Vikas said, there are multiple stones. Some stones may have a bit of a ragged edges, which is why they're stacking together and causing problems. So I would maybe start off right there. So if I can have a 12 millimeter balloon, 1.2. Okay. So 1.2, I can see the balloon. Closing it down. Okay, balloon down, please.
Methodically.
Balloon down, please. Okay, just undoing what we did. So going back there. Okay, let's just go if I can go further up ever so slightly. Okay, balloon up to 1.2. Yeah,
بالکل دیکھیں
1.2. Okay. Balloon down, please.
آپ پلان کے مطابق جا رہے ہیں دیکھو اور ان کو نظر بھی آ رہے ہیں.
Okay, so balloon up to 1.2 again.
Further up, and you can see یہ دیکھو ایک 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 کر کے لا رہے ہیں.
Then again clock. This doesn't want to come out easily. Maybe a bit bigger.
ہاں it's a bit bigger.
Balloon down,
آگے
please.
very good, very well demonstrated. دیکھو کام وہ بھی وہی کر رہے ہیں جیسے آپ کر رہے تھے صرف ایک تھوڑا سا میتھڈ اس میں ڈال دیا. ہاں ٹھیک ہے بیسکلی
Balloon up to 1.2.
کیسے آپ کو سارا نظر بھی آ رہا ہے.
Okay, balloon down, please. Okay, balloon up to 1.2 again. So I'm still staying very low. I'm still staying very low. I just want to make sure that won't cause that stacking again.
Nadeem,
Balloon down. Ji sir.
agar you can either use a trapezoid basket,
That's exactly.
or the other thing is that we can put a stent and bring him back later on, so we can move. Thank you.
That's very right. وہ
Screen, please.
ایک پر سے وہ کر لیتے ہیں پہلے میں پوجے پورے میں بیان کر لیں ٹھیک ہے. ہاں بیٹا اب کانٹراسٹ وہ کر لیں. ہاں جی ہاں تو بھی وہ رائٹ اپ اینڈ ڈو.
Ji. There are plenty of stones there. Lots of stones there. Plenty of stones still there. Okay, that's fine. Just take it. Let's just inflate it again. Okay, balloon down, please.
ہاں وہ یس
Balloon up to 1.2 again. Okay, balloon down again.
ویری گڈ.
1.2 again. Okay, balloon down again. Okay, let's just keep doing it now. Okay. So 1.2. Good. Okay, balloon down. Keep
Very
doing.
good.
Let's keep doing it. Okay. Just keep going one by one step. Balloon 1.2 again, please. Balloon down again. Closer. 1.2. Okay. Okay, balloon
Very
down,
good.
please.
یہ کمنگ یس.
Okay, 1.2 again, please. Good. Balloon down again, please.
Yeah.
Just keep doing this again.
زبردست.
Okay. 1.2 again, please. Good. Okay, balloon down again, please. Keep doing this again. Let's just keep doing this again. 1.2 again, please. Bloom down again, please.
Never ending supply of stone.
I think we're nearly there.
You are nearly there.
So is this balloon 1.2 or 1.5?
1.2.
Can you make it 1.5 as well?
Okay, let's just bring it down again. Okay, balloon 1.5. Okay, balloon down, please. Okay. 1.5, please.
Is there a stone still up there? Because we,
No stone, sir. Balloon down, please. Balloon down, please.
where is the stone? Is it way up or?
Yeah, no, I think Alpha's doing great job there. Excellent. Okay, no, you're good. Okay, inject some contrast there if you can. Yeah, just inject some contrast. Stop screening, please. Okay, there's still stone there. Okay, stop injecting. Okay, balloon up to 1.5. No, there's still stone there. I think the problem is if you start to take too many out together, it's going to cause problems. So it takes time, but then you're able to be confidently clear the duct. Balloon down, please. Okay, we're nearly there. We're nearly there. Okay. Gee, we're nearly there. Okay, balloon up to 1.5.
करो ना. You can get all your stones out.
No need of plastic.
मतलब plastic is a good policy. You have to do it. They can
Balloon down, please. Balloon down quickly. Yes. Good. Very nice. Thank you.
Yeah,
Very nearly there.
1.5 inflate?
Did you-
Yeah, because
that was 1.5.
with a duct this size, if you're going to do 1.2, the stone's going to be missed because it'll come from the side.
We were trying to clear the lower end of the duct because initially we had a problem with the stacking. So we thought,
I think there's quite a lot of stacking there.
okay, balloon down, please.
Did you do a sphincteroplasty here?
वो करने contrast is the body weight.
Gee, I think we'll do that. Wait a second, please. Let's just go there.
Okay.
Okay.
So I'm sorry I had to go. So you decided not to do a
Keep the
sphincteroplasty?
wire straight, please. That's good. Thank you. Right. So you again, Dawood actually followed Dr. Vakar's instructions and got vakarotomy done. So he had a decent size. So I think
But having said,
nearly done. Okay. Now just screen again. Okay. Get the wire up a bit, please. Advance, inflate the balloon to the maximum. Good. I think there are plenty. I think just
I would have
slipping
done
past those stones, isn't it?
15 and taken it out,
Let go,
or
please.
maybe, go for 1.5 from the very beginning.
Okay.
I think it's clear.
Balloon down, please. Okay. That's beautiful.
I can't comment.
Very nice.
Good.
To be honest, I need to start with ERCP from the very beginning. But
Okay, let's just inject some contrast again,
so
please.
now it's all blood and everything, so I can't really see the margin. But
And inflate the balloon. I think, is this the largest? You believe
I think
this
it's big.
is 18 तक जाता है? 18 तक ले जाइए इसको.
not
हाँ जी.
actually not even
Inflate 18 तक ले जाइए इसको.
not, it's not even actually.
Good.
And it's not only from Pakistan. I
Okay,
had a
stop
patient from
giving.
King's College. Who ended up having severe bronchitis, a nurse, who was told that ERCP was done. Actually, the uncle was told
15 pin. Good, 15.
So what must have happened is somebody tried to candidate.
That's good.
They couldn't candidate. Patient ended up having bronchitis, so they never went back. She continued to have pain of bronchitis. And she came here. She was specified as having another
Okay, balloon 15. Excellent. Down, please.
I said, well, hopefully nothing will
Should be
happen.
okay.
They have a look and they've done it yet. When I went in, I saw an accident.
Should be okay.
I think it's clear.
Similarly, I've seen spectrometry, which are very,
Now inflate it to the maximum.
they don't even count the fingers. And they're trying to pull out a big stone.
Keep.
So you have to keep in mind, if you've got a big
Good.
stone and
Okay,
you
that
don't do
looks
any
good.
spectrometry, just put a stent and come out. What we
Keep injecting.
Adequate tracheotomy is
You keep
depending
injecting.
on the size of the stone you want.
Injecting. Keep
Ideally, yes, when you
injecting.
see the bile coming out, you most likely you cut the trees. But that may not be adequate for a large stone. You may have more room to
Okay. 18 segment comes out. Good. I think that's good.
I think that's
When you have a large stone that
I
doesn't
think
come
we
out,
are okay. We have done.
I would have a stone, do a tracheotomy, go up, I'm putting the balloon out, the stone is big, it's not coming out. I know that I have to do something.
Very good answer. Incredibly well. Well done.
For me, it would be a sphincterography. And then try and see
Have
if
we
you can
lost the
remove
wire?
how do you decide.
That's fine. I think it was
Okay,
down to
but
me,
I think you're
not to
okay.
you. Arafat was all me.
I think you are
Very good. Well done.
well.
I think.
Because
Yeah.
of
Good.
the gurus of
Let's just advance the wire there.
have said that you align
Wait a
with
second, please.
the size of the duct. So that's
Okay.
how
Advance the wire, please.
personally do I follow that guidance.
Yeah, that's good. Thank you. So just go to the. Yeah. Let's just do the 18 again.
The distal duct is narrow. Duct is detached.
And inject contrast, please.
By using the
That's fine. That's okay. That's good. Looks. That's fine. That's fine. Good. That should be fine. That's it. No more. No. Yeah. Good. Okay, let's just see if we can bring the balloon down to 15, please. That's enough. Good. Well done. Yep.
Advance.
That's not what you have to understand what we are trying to do by
Advance. Yeah, you have to keep moving.
by clockwise rotation. You're actually pulling it away, and by going in, you're straightening the scope. Your scope is already straight. You're trying to let it go first. So you have to have that pull on the balloon, and then you do clockwise and advance.
Can we see, Mustafa, we are with you now. Mustafa, can you hear?
Yeah.
Can we see spy, because spy ke liye we would not be able to transmit here. So they need to put the camera on the spy.
Acha. Camera is. Do you know the story? Do you know the case or not?
No. Can you quickly,
A young to middle-aged male with 42-year-old with a history of violence had stent placement here about 2 years ago, and then disappeared and showed up with symptoms again. So his stent, he was symptomatic with jaundice, I think, and his stent was still in. Careful of the, so just toggle to the right.
so this was a case of choledocholithiasis. The stent was placed and the patients now come after 2 years. That's not an uncommon scenario.
There's a lot of visualization there, but you need to look at your spy image.
So we can't see the spy that well. अगर ये कैमरे को निकाल के
कैमरे को
थोड़ा
थोड़ा सा
सामने,
पीछे से लाना पड़ेगा, I think.
थोड़ा
उनको
कैमरे
नजर
को
नहीं आ रहा.
सामने से लेके आए because एक obliques are viewed.
Does this turn this way or no?
Yeah, that would be, that's great if you turn it a, I think for a focus, I think it's better now.
Okay.
Yeah, we can see it.
So the biliary stent was jammed in there. So initially we tried with the Raptor forceps, but it didn't work out. So I can tell you what we did, but if you have a situation where the stent seems to be just jammed inside the duct, just wondering how people would approach that. Sorry? You can
When
take
you
out the
say-
wire, that's fine.
No, jammed meaning like the stent tip is outside the,
Yeah, it's transpapillary, but
as
it
you
just
try
won't
and pull
move.
it out.
Well, the distal part broke off initially.
Also, distal part broke as you pulled out.
Yeah.
But
so
that happens
there's a
when the stone
right
has,
there.
when the stent has been
Stop.
left for longer period.
Yeah, exactly.
The
So that's enough. You don't need to wash more.
so we've got part of the stent
Stop washing.
in the bile duct.
That's right. So you know there's a stone. So now we're going to EHL. So look down on the spine if you can.
Sorry.
So whatever maneuver on your spine allows you to look slightly downwards.
So what did you do?
So we actually went with a CRA alongside the stent and balloon dilated starting at the proximal end of the stent all the way along the stent and transpapillary just to lift it up and create some space. And then let us get out with the snare. Then we took out a fair amount of sludge and debris, but there seemed to be a filling defect right at this level in the duct, which on these images looks like a stone on the right side. So I don't know if this is a Maritzi type of a thing where it's coming from the cystic or if it's in the main duct. But there's also obviously inflammation in the previous stent. So can we look down further with your spine or not really? We just have to be very convinced that it's the stone that we're about to EHL. Yeah, I think that looks like wash that a bit and advance the scope.
So Mustafa,
Lavad?
hello.
Yes.
Mustafa, so आपने CRE alongside the balloon किया.
Alongside the stent, Hanji.
Yeah, alongside the stent, I beg your pardon. And then you remove the stent.
Stent with the snare.
Yeah.
That loosened it up, so we were able to advance the spyglass.
Okay.
So then we were able to watch the loop in the duodenum. Lift with your
And
big wheel.
the stone was obviously, then you did a cholangiogram which showed the stone to be big.
Yeah, we saw a filling defect right about here. Let me go over just for a second. Thanks again. I got it. Of a stone
So we have
in this
three pictures.
mid to distal duct.
So this is inside the bile duct. Okay. And that's what's happening in the duodenum, and then you have the fluoro. But this is what is telling you. But obviously we're not directly transmitting, so it's not as good. But
So right there.
now it's very good.
So now you can see that this is stone material right there, right? Fluoro? Sorry. And this is about the level where we were seeing an irregular sort of, and the balloon was getting hung up, and you can see that there's a stone there. So now we're going to do EH. Upper probe, is it ready? Okay, good.
You have to be out.
You're going to do it. I just need to, oh, there it
The
is.
bile duct, you can't see a.
I think that's probe.
No.
Yes, so we need to pull it back a bit.
Distal CBD.
Okay, so this is your stone.
It's
There's your
for
probe.
Mid and upper.
And all you have to do is shoot at it.
For distal
Okay.
CBD, we use EUS.
आप पानी कर देगा, हाँ.
And that I'm
Okay,
talking
go
about
for it.
strictures, right? Stone,
And if you do big wheel towards you, they'll take you towards it like that. See? Okay, now. Yep, go for it. Everybody's ready. Good. Keep at it. Keep at it. So pull back the probe. You don't have to make contact with the HL. You just have to be close to it, and it has to be fluid filled. Good. Keep going. Keep going. Pull back on it. Don't hit the stone. Just pull back. Give it some gap, and then do it. Small, your spy wheel to the left or right can help sometimes. There you go. Get off it and now do it. Big wheel towards you. You have to be careful of the bleeding to your left of screen. Lavage. Wash kare. Okay. Get your spy forward. There you go. Push. And where's our probe? Can we see the probe? There, right? Go ahead and EHL. Big wheel slightly towards you. Okay. Keep it towards you. Okay. Don't let it fall back. Where's your probe? Do you see it? Okay. Let me take a look. I think you're in the right place. But just yeah. Okay. We just need to get up to it, right? Like, figure out. Okay. Stop. Stop washing. So I'm just changing my dials just to see what gives me the best view for this stone. So right there, wash. Okay, so that looks like a very hard stone to me, but I need to see my probe because it's getting bent here. ये probe जो है ना नहीं मुड़ गया है ऐसा kink हो गया है इसको. Yeah, let's just change the probe for a sec. Meantime, let's see if I can get past it for a second. Okay, so that's intrahepatics. Yeah, and it's not over yet. Zara can I?
What's the issue, Mustafa? Oh, you can see the probe now.
Now we can see the probe got stuck for a second, so we had to pull back. So this is up, like in the proximal deck, but the obstructing stone is actually further back. So sometimes just for treatment effect, you can just zap some stuff on the way out, but I'm just gonna pull back on the probe a tiny bit.
When you're doing this, Mustafa, you've also got your pedal on the water thing because it
Yes.
works when you've got water in, right?
Yes,
you need
yes.
to make sure that you don't really have to touch it, and as long as you have water there, it should work.
Yeah, and I want to get to the area where the stone is most obstructive, and try and So right here, wash. I wish I could see the probe better there. بہت ہارڈ اسٹون ہے یہ ہائیسٹ لیول پہ نا the setting is high ہے وہی it's a stubborn stone.
Yeah, so
The problem with this,
the plan here is that you are actually trying to create a space and break, and hope that the rest of the fragments will actually.
yeah, the other problem with this situation is that he's non-compliant, which is something you have mentioned before.
No, that we're kind of used to it now.
So I mean, at what point do you say enough for one day? But then if you put stents in, then how do you know he'll come back?
No, he will. Now he will.
Acha.
Now he will. As you know that our systems have become very stringent when we do therapeutic cases. We follow them with a telephone call. Every therapeutic case is followed at 24 hours and again at 7 days. And what we do is we take more than one number as well.
Yeah.
And the national identity card, which is unique to every Pakistani, is also with us. Like the number is with us. So for tracing them back, we have a team that it's their job to trace them back. So now hopefully this will not happen. Previously, as you can see, this was 2 years ago. So it will not happen. So I would suggest if you feel appropriate, you can actually put a stent and we can finish this off later on.
I think so too, because this is a pretty stubborn stone.
Yeah, fair enough.
The only question in my mind is
there something else there?
I don't think so. He's young, and I think it's all stone disease. And we went up to Baskare. Do you ever do, since you have the machine, do you ever do S-wall for these or no? I think wire dalne we can come out. So I didn't pay too much attention to that, simply because, I mean, not that you shouldn't, but we're in the duct and the main concern is like staying stable inside the duct. But that loop was more than I expected to see when I actually looked around. But your main focus is how do I get a good look on the inside. Isko antibiotics mili hai na? He got antibiotics. Okay. So I think the practice may vary from place to place, but I usually put in double pigtail stents here, and I would typically do 2/7 double pigtails. But I'm not sure what the preferred choice here is.
We usually have put straight plastic stents.
Straight?
But I think if you want, there should come double pigtail as well. So
Okay. Okay. Yeah, wires up nice and deep. Exchange. हाँ जी. I think you can do a stent. I don't know if they prefer straights. That's fine too. Sometimes if you have a lot of space, then they can fall out. That's the only thing with straight stents. Since so you have 7 double pigtails, so क्या length क्या है उनकी? 7, 9. No, I think we're just gonna put stents in and come out. 7, 4, short, yeah, 7, 6.
So we can start. आपने सबसे पूछ लिया. Like first thing is I like the scope to be here. आप यहाँ से डालेंगे. So you're actually creating this here. Keep your scope in here. Right? हो गया China. Finally हो गया. चलो बिस्मिल्लाह.
Yes. Sir को दीजिए.
Dr. Saad, you are live on the. Can you hear?